Hi everyone, thank you so much for considering St. Catherine University to further your education and become a pediatric nurse practitioner. My name is Cassandra Hosher and I'm an assistant professor and co-coordinator of the Pediatric Nurse Practitioner track. Today, I'm really excited to walk you through our Pediatric Nurse Practitioner Doctor of Nursing Practice program, what makes it unique, what you can expect, and how it can help you reach your professional goals. Before we dive in, I always like to start with what matters most, quality and credibility. St. Catherine University is fully accredited by the Higher Learning Commission, and our nursing programs are accredited by ASIN. What that means for you is that you're receiving a high-quality, nationally recognized education that prepares you for certification and practice. So why choose St. Kate's? We are truly a mission-driven institution. Everything we do is grounded in social justice, equity, and caring for our communities. You'll also notice a strong emphasis on evidence-based practice, population health, health equity, but what students often tell us stands out the most is the personalized faculty mentorship. We don't just teach, we support you every step of the way, especially with clinical placements and your DNP project. And finally, this program is very much about real-world application. You're not just learning theory, you're applying it immediately in clinical settings. Let's zoom out for a moment. Why pursue this path? Well, first of all, there's a projected 42 to 52% increase in NP employment, according to the U.S. Bureau of Labor Statistics. This is huge, but beyond job security, this role allows you to lead in healthcare delivery, influence systems and policy, increase your autonomy and flexibility, and honestly, one of the biggest reasons students choose this path is impact. You're shaping the health of children and families for generations. We understand that our students are at different points in their careers, so we offer multiple pathways. You can choose a 3-year full-time option, a 4-year part-time option, or a postmaster's certificate with or without the DNP. We've intentionally designed these to be flexible, especially for working professionals. So who are these tracks designed for? If you're already an NP and want to expand your scope, the postmaster's certificate is a great option. If you're looking to combine specialty training with doctoral level leadership and systems change, the DNP pathway is ideal. It really depends on your goals, and we're happy to help you figure that out. Now let's move on to structure. Our program includes 68 total credits, 810 direct patient care hours, and 360 hours dedicated to your DNP project. One thing students love is that we secure your clinical placements, which is a huge stress reliever. You'll also experience leveled simulation throughout the program, so your skills build progressively. For those of you wanting to pursue the postmaster's certificate, this program is 21 credits. It is 810 clinical hours, and you receive the same strong support with placements and simulation. It's a streamlined program, but it's still very comprehensive. If you would like both the PNP certificate and DNP, the program is 53 credits total. It is 810 direct patient care hours and 360 hours dedicated to the DNP project. This project is focused on quality improvement. This is really for clinicians who want to step into leadership and systems level roles. Our program is delivered in a hybrid format, which gives you the flexibility while still maintaining connection and engagement. You'll have a mix of online learning, synchronous sessions, and in-person or hands-on experiences about 1 to 3 times per semester. To apply, you'll need an unencumbered RN license, a BSN or graduate nursing degree from an accredited program, a GPA of 3.0 or higher. We're looking for students who are academically prepared and committed to advancing pediatric care. By the end of this program, you'll be prepared to sit for PNCB certification, deliver advanced pediatric care, lead in systems and policy, and improve healthcare outcomes. Our goal is to graduate confident, capable, and mission-centered providers. A few common questions that we get are, can I work while in the program? Yes, you certainly can, but we recommend no more than a 0.6 FTE in the 3-year track. Even this is too much for some students. Some students will not work at all during the program, and others will work significantly lower than a 0.6 FTE. It all depends on what you can manage and what works best for your life. What's the workload like? You want to plan for about 2 to 3 hours per credit each week outside of class. For example, a 3-credit course is 6 to 9 hours per week of course activities. How big are the cohorts? We keep our cohorts small with a maximum of 10 students to allow for personalized attention. How are students selected? Selection is based on your application and qualifications, not just seat availability. We take into account a variety of your application components, including your video submission, your essay admission, and your reference. If you have questions about admissions or financial aid, Taylor Hennegar is a great resource. For program-specific questions, I'm always happy to connect with you directly. If you're feeling excited about this next step, we encourage you to apply. Please check out these additional resources, including information on how to apply, meeting the faculty, admissions and aid, and tuition and fees. Thank you so much for your time today. I truly believe this program prepares you not just to be a provider, but to be a leader and a change maker in pediatric healthcare. I'd love to hear from you if you have any questions.